Just a reminder that all proceeds from our channel are donated to charity. Please help us help others by giving us a thumbs up, commenting, or subscribing to our channel. Your support makes a difference. Embarking on an expedition cruise to Antarctica or other remote destinations is an adventure of a lifetime. But what happens if you have a medical emergency? In this video, we speak with Dr. Jaco Smit, Senior Doctor with Carnival Corporation, about key health and safety considerations for expedition travel. We'll explore the medical facilities and staff on board, Seabourn's collaboration with the University of Texas, emergency evacuation procedures and essential preparations before you travel. We'll also discuss the onboard pharmacy, the importance of bringing necessary medications, travel insurance, and answer a common question about cruising while pregnant. This video is not medical advice, but aims to give you some of the tools you may need to have an informed discussion with your medical provider before booking or boarding an expedition cruise. Seabourn is part of the Carnival Corporation, which operates over 90 ships across 9 brands. The medical facility on Seabourn expedition ships is located on Deck 3, mid-forward, on the starboard side of the vessel. Dr. Smit, who helped set up the Seabourn Venture's medical facilities, explained that all doctors and nurses across Carnival's fleet are ER or ICU trained. Every new ship in the corporation follows the same standardized medical setup, ensuring that emergency equipment is packed and organized identically across all vessels. The medical facilities on board meet or exceed the standards set by the Cruise Lines International Association and the American College of Emergency Physicians. The ship features 2 general treatment rooms, one with 2 beds and another with 1, similar to those found in doctors' offices or emergency rooms. There is also an X-ray unit and a lab with staff trained in standardized protocols, as well as a point-of-care ultrasound, an essential diagnostic tool. Medical images can be transmitted instantly for remote consultation, just as they would in a land-based hospital ER. In critical situations, the ship's ICU is fully equipped to provide life-saving care, including infusions, nebulizers, oxygen therapy, ventilation, defibrillation, pacing, and more. A portable emergency stretcher, similar to those used in ambulances, is also readily available. For further details on this cruise ship medical facilities, we'll include a link in the video description to the American College of Emergency Physicians Cruise Ship Healthcare Guidelines, which Carnival Corporation follows. This resource provides valuable insights into staffing, pharmacy, equipment, and more on Seabourn expedition ships, which you may wish to share with your healthcare provider. Dr. Smit explained that a key advantage for passengers is Carnival Corporation's partnership with the University of Texas Medical Branch Health System. This collaboration allows onboard doctors to consult with specialists, such as cardiologists, in real time using the ship's Starlink internet connection. This telemedicine service enhances remote consultations, helping to optimize a passenger's treatment and ensure they receive the most advanced care possible while on board. The medical team provides care on board utilizing their training and the University of Texas partnership to deliver the most effective treatment possible. However, if a patient requires care beyond what can be managed on board, established evacuation protocols are in place. Seabourn expedition ships travel to extremely remote regions, not just Antarctica, but also destinations like the Amazon and the Arctic, where medical evacuations can be particularly challenging. Dr. Smit explained that in Antarctica, patients can be transported to an airstrip at St. George Island for evacuation to the mainland by airplane, as helicopters cannot cover the distance. Another option is transferring a patient to a vessel returning to land. One thing we found particularly eye-opening was how real these medical transfer scenarios are. After we returned home, we read online about a passenger being transferred from Seabourn Pursuit to Seabourn Venture, which was already heading back to South America. exactly the kind of scenario Dr. Smith told us could happen. As a last resort, the ship itself may have to return to the mainland, potentially impacting the cruise for all passengers. Dr. Smith highly recommends that those with medical concerns should schedule a visit with their physician before embarking on an expedition. While Seabourn does not require passengers to submit a medical history in advance, having one readily available can be extremely beneficial, especially for those who take daily medications or have complex medical conditions. In an emergency, being prepared can make a critical difference, particularly if you are unable to communicate your medical needs. Additionally, we encourage you to familiarize yourself with the terms of your cruise contract, particularly if you have concerns about your rights in the event of a medical emergency. The contract includes important provisions regarding eligibility for sailing, the cruise line's liability, medical services, and dispute resolution. We'll put a link to this in the video description. Seabourn works with a dedicated pharmacist in Miami to manage onboard medication supplies, ensuring the formulary is regularly updated to reflect passenger needs and the latest medical advancements. If your healthcare provider requires more details on the types of medications available on board, the American College of Emergency Physicians Cruise Ship Healthcare Guidelines we pointed out earlier are a great resource. We've included a link to this document in the video description for easy reference. That said, passengers should always bring a sufficient supply of their prescribed medications. We personally pack at least an extra week's worth of our own prescribed medications to account for any travel delays, as not all prescriptions may be available on board or in foreign locations. Additionally, we carry our preferred over-the-counter medications to manage minor ailments, helping us avoid unnecessary trips to the medical facility and any associated costs. We asked Dr. Smith about travel insurance. His strongest recommendation is to have travel insurance. In fact, he personally never travels without it. He explained that if you receive treatment in the ship's medical facility, you will be provided with an itemized bill, along with instructions to help you file a claim with your insurance provider. However, Seabourn does not submit insurance claims on your behalf. Dr. Smith confirmed that Seabourn uses commonly known codes that insurance companies in the USA and other countries frequently use, ICD and CPT codes. This may be important information if you need to discuss an expedition cruise with your insurance provider. If a medical evacuation is necessary, Seabourn will immediately activate your medical evacuation insurance. In some cases, your insurance provider may have agreements with specific Medevac companies, which can help streamline the process. Additionally, Carnival Corporation has dedicated teams and regional hubs to assist with medical evacuations. Given the potential high costs of medical services and the limited medical facilities on board, it's crucial to consider comprehensive travel insurance that covers both medical treatment and emergency medical evacuation. Seabourn offers a protection plan known as Seabourn Shield, which includes emergency medical evacuation coverage up to $100,000. However, considering the high costs associated with medical evacuations, especially from remote locations like Antarctica, this coverage may be insufficient. Some experts recommend having at least $500,000 in medical evacuation coverage for such destinations. Additionally, if you have an insurance policy or policies already, make sure that cruises to Antarctica are covered. Some passengers may have additional considerations such as pregnancy, and Seabourn has strict policies in place. Expectant passengers are not permitted to sail if they will be 24 weeks or more pregnant by the final day of the cruise. Additionally, all pregnant guests must provide a physician's letter confirming they are in good health and not considered high risk. Dr. Smith emphasized that traveling while pregnant carries inherent risks, particularly on expedition cruises, where access to an obstetrician could take days. Furthermore, adequate fetal monitoring is not possible on board. We hope this information helps you plan your expedition cruise to remote destinations like Antarctica, the Arctic, or the Amazon with confidence. A special thank you to Dr. Jaco Smith and the entire medical team aboard the Seabourn venture for sharing their expertise with us during our Antarctica cruise. Your health and safety are key to making the most of your adventure. As always, remember to make meaningful and healthy travel happen, and we'll see you next time.